A manipulator is a surgical device that brings an organ either into the operative field or out of the operative field. For example, with a hysterectomy, you would use a uterine manipulator to bring the uterus into the operative field to make it easier to operate on the uterus. If you were doing a prostatectomy, for example, you could use a bougie in the rectum to manipulate the rectum out of harm's way so it doesn't get damaged during the prostatectomy. So manipulators are used to bring an organ either into the surgical field or out of the surgical field. For example, if someone was doing a hysterectomy, you would use a uterine manipulator to bring the uterus into the field and make it easier to operate on. But if you were doing a prostatectomy, for example, you could use a rectal manipulator to bring the rectum out of surgical danger, I guess you could say, so it doesn't get injured. One of the more generic or ubiquitous manipulators is something called an EEA sizer, which is an end-to-end anastomosis sizer, or there are can also be called a bougie, and is a very generic, similar to this but completely stainless steel, and it's a manipulator for the rectum or the vagina. I think almost every specialty uses a manipulator to some degree. I am most skilled in surgery for the pelvis, and so we use manipulators as gynecologists, urogynecologists, urologists, colorectal surgeons. We all use manipulators to, again, like I said, to move the rectum out of the way, to move it where you need it to dissect around it, or other organs like the uterus. So the EndoGlow manipulator is unique in a few ways. The shape and style of it is very similar to manipulators that surgeons have been using, but what's unique about it is the polymer that it's made out of. One of the inherent properties of this plastic is that it fluoresces under near-infrared imaging. There's no batteries, you don't have to plug it in, there's no injection as far as it fluorescing. You just use it like you normally would and turn on the near IR feature on your imaging system and it will fluoresce. So that's really one of the truly unique features of the GreenEgg and of all EndoGlow products. So when I operate, I always start off my surgery using an EndoGlow manipulator, like the GreenEgg, for example. And I go about my surgery, and when I come into an area that I think is going to be tricky or I'm not as sure of, I will turn on the near IR mode with the product in either the vagina or the rectum. So the advantage of doing that is the polymer transilluminates the tissue. So it lets me see relative tissue depth, for example, if I am operating robotically. In robotic surgery, there's no haptic feedback. You can't feel the tissue, you can't feel the quality. Everything is visual. And so being able to transilluminate the tissue lets you see the quality of the tissue you're operating on. And that's really valuable. The other way it's valuable is you can see relative tissue depth. You can't feel the tissue and see if it's thick or thin, but you can see if it's thick or thin. And that has been really good as well. Another place that it has been very helpful is with pathology like endometriosis, for example. Because it transilluminates the tissue, you can see endometriosis that is below the surface of the viscera or below the surface of the peritoneum. And that has been great. There's no power necessary as far as there's no batteries. You don't have to plug in the GreenEgg, nothing like that. So I've been using the GreenEgg for about 2 years now, and I use it on all of my cases. And I do that because you never know when you're going to need fluorescence. You don't want it to be an afterthought. And the way I do it is I operate. If there's a question in my mind, I turn on near infrared to see if I've dissected the bladder down completely, or if there is pathology underneath the surface that I'm not aware of. If I'm going to change my surgical decision making based on what I see, I rotate the device, or I have my surgical assistant rotate the device. I want to make sure there's not debris over the egg that is giving me a false impression of what I'm seeing. So if I turn the egg and my surgical impression is the same, then I go ahead with that decision based on what I see. I can't say everybody uses a manipulator, but most people use a manipulator. It depends on what type of surgery you're using. And like I said, I'm a pelvic surgeon, and in the pelvis, almost everybody uses a manipulator of some sort. So we have based the design of the GreenEgg on a very common manipulator. The surgeon does not have to change their surgical flow at all. All they have to do is substitute their normal manipulator for the fluorescent manipulator, operate as normal, and then switch to the near IR mode when there is a crucial decision to be made, or just to check to make sure everything's the way you want it. Like with bladder dissections, is the rectum out of the way with doing a prostatectomy? If you are doing a rectopexy and you need to bring the rectum down, make sure this is in the vagina or the rectum. It's also great if anatomy is distorted and you just don't know where the rectum is or the vagina is. This is a great place to start by putting it inside the rectum or the vagina, turning on the near infrared mode. Now you know where you are. Now you know where your organs are. It's all about patient care too. We all want our patients to have the best outcome that they can, and this helps. The fluorescent manipulator can be used in conjunction with ICG. They can be used together. However, there are some contraindications to using ICG that we don't see with our fluorescent manipulators. For example, there's a contraindication for using ICG in someone that has an iodine allergy. That is not the case with the fluorescent manipulators. You can use it in people that have iodine allergies. The manipulators are also latex free. Another advantage of using the EndoGlow products in every case you do is that you don't have to have forethought about it. You can just have it in place when you need it. For example, when using ICG, unless you plan it ahead of time, there's a pause and a lull in the surgery while the ICG is retrieved, mixed, given to the anesthesiologist and injected. With our near infrared fluorescent manipulators, you already have it in place. Once you have the thought of going into near IR mode, you just have to do it. There's no talking to the nurse, there's no running to get drugs.